Welcome back, everyone. I'm Yusuf RL, pharmacist here in the United States. Today will be our last video in this series about every birth control option available within the United States. And of course, we cannot end off this series without talking about emergency contraceptives. So, imagine the situation. You have a woman who just had intercourse with a partner, and they wake up the next morning and oh no, they forgot to take their contraceptive the previous day, or they've just forgot to take their contraceptive for a while. What should they do at that point? Well, they have a few options. They have emergency contraceptives. The emergency contraceptives will either consist of a progesterone or the copper IUD, as we discussed. Now, the mechanism is that it's supposed to thicken the lining of the endometrium and in the uterus to prevent the egg from implanting itself. So this actually allows that the woman has a little bit of a window of time after unprotected sex to then try to prevent pregnancy. And the window will change depending on the product. In terms of mechanisms, copper IUDs, besides for increasing the lining of the endometrium, also have that toxic effect towards sperm, so it can prevent any sperm from fertilizing the egg. But we'll discuss each of these options more in depth now. As a little side note, combined oral contraceptives have been used in the past as a form of emergency contraceptive, and they still can be used nowadays. So what the patient would do is that they would be told to take a higher dose of the COC than usual, which would be called the UPS method, or YUZPE. The idea is that a patient would take 2 tablets within a day to try to prevent that pregnancy, but it's not used as often nowadays just because the other emergency contraceptives are a lot more effective, and there's also less side effects, and the other ECs are just more accessible to patients nowadays. So because of that, I won't discuss it here, but it's good to know about it. Moving on, we'll discuss the copper IUDs first. I won't discuss them too much here, as I discussed them in my IUD video earlier. What I will say is that the copper IUDs, when used as emergency contraceptive, are 99% effective in preventing pregnancy when used within 5 days of unprotected sex, which is the highest out of all the ECs out there. But keep in mind, it has to be inserted by a healthcare provider, so a patient would have to, go to a clinic or an office, tell them they need the copper IUD for emergency contraception, and they should hopefully be taken in relatively quickly. But from what I've seen online and in forums, patients may not be able to get it right away. It may require more than one visit, just because of physicians not really recommending it or not wanting to use it right away. It's something that patients do have to keep in mind, though. But that's the first option. Then in terms of hormonal or medicated emergency contraceptives, there's 2 options. First option we have is a levonorgestrel in a 1.5 milligram tablet. Now, this is obviously a very high dose of levonorgestrel compared to what you'll see in regular contraceptives containing it. What a patient can do is that they can either take 1 pill just whole, or they could split it in half and take each half within 12 hours. The option is very commonly known as Plan B one-step, but it also comes as a generic under a wide variety of names, and I'll just show a few pictures of those generics here. And you can buy them pretty cheaply if you do get the generic. I think I've seen them as low as like $13 in like a CVS. So you can get them pretty cheaply, and it's actually recommended to have emergency contraceptives on hand, just so there's no delay to when a patient takes them. And it's also available over the counter, so a patient doesn't need a prescription. They don't need to go to the pharmacy counter to get it. They can just go in and grab it and head out. But the thing is, I think Plan B or levonorgestrel should be a behind-the-counter medication like Sudafed. My reasoning is the same as with Opill, in that there's a few things that patients do need to know about the medication, and we just can't guarantee that the patient's going to read that information from the back, from the drug facts on the Plan B, for example. A few things that patients need to know. One, it only works within 3 days or 72 hours after unprotected sex. If a patient takes it after that, it's not going to be effective. But of course, it's more effective when it's taken closer to when the intercourse happens. So if it's taken within 1 day after unprotected sex, it's supposed to be more effective. There have been reports of it having coverage for 96 hours, but it's just right now the labeling is just for 72 hours. Another thing a patient has to keep in mind is that if they do vomit and like throw up 2 hours after taking the pill, which can happen because it's a high dose of levonorgestrel, it can cause nausea at that high dose, they may have to retake the dose again, meaning that they don't have that protection that they're supposed to have. But the thing is, a patient wouldn't know this unless they read the back and they read the drug facts, which we can't guarantee that. So you could run into a situation where a patient may not read the drug facts, they vomit, they think they're fine, but then in reality they don't have any protection and oops, they get pregnant. And it could just be a very confusing, you just put the patient in a very confusing and conflicting spot where they thought they were good, but then they're not really. Another thing to keep in mind is that Plan B is not 100% effective. From what I could tell, it's around 87.5% effective, which means 7 out of 8 women, at least according to the Plan B website, should be able to have the intended effect of this medication. While it's a very high efficacy rate, it's still not 100%. So we should warn patients about that and make sure we screen for things that can lower the efficacy, just to avoid confusion, avoid mix-up, and basically give the patient a heads up that, hey, there's a chance that you may still become pregnant even after taking this. And finally, levonorgestrel and really all progesterones in general do have drug interactions and drug disease interactions. So certain seizure medications can interact with levonorgestrel. Certain antibiotics could interact with levonorgestrel. So unless we're screening for that and we're catching that at the point of sale, there's no way of us knowing if the patient may experience one of those interactions. And then again, you're into a situation where either their birth control doesn't work as well, or their seizure medication may not work as well, or their antibiotic may not work as well. And again, you just run into problems with that. And the only way that you could kind of avoid these problems, or at least screen for them, is if the patient at least talks to a doctor or a pharmacist beforehand, before they buy it. But in the current situation that we have now, a patient can buy the medication and not really know any of this information, and they're almost putting themselves in a little bit of a risk with kind of the options I mentioned, and could put themselves in a less than ideal situation. But for now, it is over the counter. It can be bought online or in person from practically everywhere. Makes it widely accessible and very cheap. Now we will discuss the other hormonal option, which is ulipristal. It's also known as the brand name Ella, or ELLA. Now this drug is extremely unique because that it's not like the other progesterones that we mentioned where it's just a straight progesterone agonist. It actually falls under the category of a selective progesterone receptor modulator, or an SPRM. What that means is that it has a mixed action. It has a mixed agonistic and antagonistic effect on the progesterone receptors. What do we mean by that? So it has a mixed agonist option in terms of that it promotes progesterone function. It has a mixed antagonistic effect in that it does not promote or blocks progesterone function. You can kind of think of it, let's say you have like a little, scale. You have levonorgestrel on one side, which is the progesterone agonist. You have mifepristone on the other side, which is a progesterone antagonist. Ulipristal falls right in the middle, and that has that mixed effect. So what this does is that it gives it the effect of it being able to prevent pregnancy from its agonistic activity, but also can avoid some of the side effects due to its antagonistic activity. And also it won't be able to terminate a already existing pregnancy. So it has a very interesting effect, but it achieves the same results in that it is meant to prevent pregnancy. Now how it works is that it will actually postpone the release of the egg, thus inhibiting or delaying ovulation, depending on when it's taken, of course. The cool thing about ulipristal is that it can be taken within 5 days or 120 hours after unprotected sex. and it's usually around 85% effective, which is, really high efficacy rate, but again, we should warn patients that's not 100% effective. Of course, the earlier it is taken, the more effective it's supposed to be. One important thing to note about ulipristal is that the patient, after they do take it, they must wait 5 days before they can resume normal hormonal contraceptives due to its activity. This is a lot different compared to like Plan B, for example, where once a patient takes it, they could just resume their normal contraceptives right away. But during this time, if a patient takes Ella or ulipristal, they have to wait 5 days before they could take their hormonal contraceptive again, and they have to use a backup method like condoms or diaphragms, for example. But otherwise, similar to Plan B. But with that, we conclude our series about all the birth control options available in the US. So as you can see from throughout the series, there's a wide variety of options available to patients when it comes to birth control and emergency contraceptive. And it really highlights the innovations that can be seen within medicine and pharmaceutical development as a whole. You just get this beautiful thing where something that's been around for decades could be reinvented and improved upon continuously to create, very interesting and unique formulations that have their own benefits to patients. But otherwise, please let me know what you thought about this video. Please let me know what you thought about this series. Let me know if I missed any formulations out there. I've tried to be as thorough as possible. Of course, things could have slipped through the cracks. Anyways, please like, comment, and share this video. Please subscribe to the channel. Please let me know what you liked about this video and the series, what you think can be improved upon. But anyways, that's all from me. Thank you so much for watching, and I hope to see you guys all next time. See ya.